I've been reading What to Expect When You're Expecting, and I've gotten to the part where it talks about what to expect at your first doctor's appointment once you are pregnant, and I was a little surprised at how elaborate it is. It says it will usually be your most thorough and extensive visit for your whole pregnancy. They usually will do a urine test and a blood test to both for the purpose of confirming the pregnancy. It says many also do a very early ultrasound because that is the most accurate way of dating your pregnancy. They'll want to know when the date of your last period was. They will take a complete medical history, including what immunizations you've had, any chronic illnesses, any major illnesses or surgeries that you had, any known allergies, what supplements and medications you take, your mental health history, your gynecological history, including the age of your first period, details of your cycle, whether you have problems with PMS or PMDD, any prior gynecological surgeries, or OB history if you've ever been pregnant or have had babies before. Also, questions about your lifestyle habits, including your typical diet, whether or how you exercise, whether you drink, smoke, etc. A complete physical exam will be done. This includes the basics like checking your heart, lungs, breast, abdomen. It will include a blood pressure measurement that will be used as your baseline reading for the rest of your pregnancy. They'll note your height and weight. They will look at your arms and legs for varicose veins or swelling to serve as a baseline for future visits. They will examine your bikini area, like between your legs. I don't know if I can say the G word on here. And we'll do an internal check of your V and cervix with a speculum, kind of similar to when you get a pap smear. Examination of your pelvic organs bimanually, which means one hand is inside of you and one is on your abdomen and possibly through your rectum and V. They will assess the size of your uterus and the shape of your pelvis. This is a variety of tests. It says these aren't done necessarily at every clinic, but all of these are common, at least in some regions of the US. Some of them are regional. A urine test to screen for glucose, protein, white blood cells, blood, and bacteria. A blood test to determine your blood type and Rh status, as well as to check for anemia and measure HCG levels. Screening for antibody titer levels and your immunity to certain diseases like rubella and chickenpox, and possibly for vitamin D deficiency. Tests for a variety of STDs or STIs, a pap smear to screen for abnormal cervical cells, and then only for some people based on their history, sometimes genetic testing for cystic fibrosis, sickle cell anemia, thalassemia, I don't even know that one, Tay-Sachs, I might have pronounced that one wrong too, or other genetic diseases if you haven't been screened for these before conceiving. Possibly a blood sugar test if you are considered to be obese, have had gestational diabetes or a very large baby in the past, if you have a family history of diabetes or other risk factors for gestational diabetes. Yeah, so that's everything that it lists to expect at your first visit.